on the rib cage. The rib cage encloses and protects the heart and lungs, and it is flexible enough to expand and contract when we breathe. There are 12 ribs, the bottom two being floating ribs because they're only attached to the vertebrae. All 12 ribs are attached to the 12 thoracic vertebrae. The sternum is a major part of the ribs. It is a flat plate located in the center of the chest. The first 7 ribs are attached to the sternum through cartilage, and the sternum helps protect the bones and heart from physical trauma.
Corsets, which were worn during the Victorian ages, were used to make the waists of women smaller. The corsets were detrimental to the women who wore them because they pushed the ribs inward, therefore constricting the organs within the rib cage, especially the lungs. Now I will show you a claymation of what happens to the ribs.
As you can see here, the rib cage is being pushed inward and is changing shape due to the corset.
The internal pressure caused from wearing corsets will cause the organs within the rib cage, such as the intestines, to sag.
The most prominent changes are the decreased capacity of the stomach and intestines and the inability of lungs to take in enough air. This model demonstrates how the lungs take in air. The balloon being pulled at the bottom is the diaphragm, an internal skeletal muscle that extends across the bottom of the rib cage.
Although not seen here, the rib cage surrounds and protects the lungs, or the 2 small balloons. When the ribs begin to push inward towards the lungs due to corsets, the lower lobes of the lungs become restricted and are unable to take in a normal amount of air.
This causes the women wearing the corsets to have shortness of breath. Without the full use of my lungs, it would be harder to do this. Or this. Or this. Or this. Now you know all about the rib cage and the effects of wearing corsets on the ribs.
Thanks for watching.